Introduction to lung cancer. Lung cancer is a disease that occurs when cells in the lungs grow abnormally and form tumors, affecting breathing and potentially spreading to other parts of the body. It is one of the most common and serious cancers worldwide, often linked to smoking, but non-smokers can also develop the disease. Lung cancer is mainly divided into two types. The first one, non-small cell lung cancer, NSCLC. This is the most common type, accounting for about 85% of cases. It tends to grow more slowly. The second one, small cell lung cancer, SCLC. This is less common but grows rapidly, spreads easily, and is more challenging to treat. Let's look at the causes and risk factors. The primary cause of lung cancer is smoking. Cigarettes contain harmful chemicals that gradually damage lung cells, eventually leading to cancer. Smokers are at the highest risk, but long-term exposure to secondhand smoke, air pollution, and other toxic substances can also increase the risk. Additionally, a family history of lung cancer and certain genetic mutations may contribute to the disease. Prevention is of critical importance. The most effective way to prevent lung cancer is to avoid smoking and exposure to harmful substances. If you smoke, quitting can significantly reduce your risk. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and reducing exposure to air pollution may also help lower the risk. Although lung cancer can be difficult to treat, medical advancements have improved survival rates. Early detection is crucial, so if you experience persistent unexplained coughing, chest pain, or other related symptoms, especially if you smoke or have a family history of lung cancer, you should seek medical attention promptly. How is lung cancer diagnosed? Doctors typically use chest X-rays and CT scans to check for lung cancer. If a suspicious mass is found, a biopsy, taking a small lung tissue sample, may be performed to confirm the diagnosis. For high-risk individuals, such as long-term smokers, doctors may recommend low-dose CT scans for lung cancer screening to detect the disease as early as possible. While lung cancer is a serious disease, understanding its risks, symptoms, and treatment options can help people take proactive steps toward prevention and early diagnosis. Now let's look at the symptoms of lung cancer and the available treatment options. Symptoms. Lung cancer may not cause noticeable symptoms in its early stages, leading to late-stage diagnoses. However, as the disease progresses, the following symptoms may appear. Persistent cough that doesn't go away. Coughing up blood. Shortness of breath. Chest pain. Hoarseness. Unexplained weight loss. Extreme fatigue. Treatment options. The choice of treatment depends on the type and stage of lung cancer. Surgery. If detected early, surgery may be performed to remove the tumor. Radiation therapy uses high-energy rays to destroy cancer cells. Chemotherapy uses drugs to kill or slow the growth of cancer cells, often for advanced lung cancer. Targeted therapy focuses on specific genetic mutations in cancer cells, mainly used for NSCLC. Immunotherapy boosts the immune system to help fight cancer. I hope this introduction is helpful. Thank you for watching. Please subscribe for more upcoming videos.